Now, to continue where we left off, where we're talking about skills and headmasters and how to take the test. Now, when you're taking your test, you want to make sure that you come in 20 to 30 minutes early for your skills portion of the test. So when you get there, you want to get there ahead of time so that you can get signed in. She can check you off, make sure that you're there, and get you prepared to take the test. So she may do a walkthrough of the classroom or the clinical setting so that you know what the expectations are, and then she may have you sit in the rest area. So it'll be a little area that has a rest area where everybody else is sitting. So when the candidates are testing, you will be sitting in an area away quietly so that the candidate that's testing will be able to test without any disturbances. So when you get there, you want to make sure that you come with your state ID, your driver's license, passport, high school identification, or green card, depending on what you need, but it has to be a picture identification. So when she puts it in the system, she's able to see who the candidate is, and then she can check you in and then move forward. Now, once you come in and you checked in, you want to make sure you have on your proper clinical setting. So when you come in, you want to have on a clean uniform, scrub when you come in so that you're able to test. Okay, I can't tell you how many students come in. They don't come in uniform. They come in their street clothes, and you're in a clinical setting. So you may be turned away. So to avoid that from happening, you want to make sure that you come in your uniform so that you can get tested. Then you want to follow instructions. So when the instructor goes through her testing, she's going to read you scenarios of what to expect. So she will already know, that proctor will already know what you are here to do. So what she will do is read you a scenario. So once she reads you the scenario, she's going to tell you what the expectation is. Do not go into that skills trying to do more. Well, I thought I was supposed to do this, and I thought I was told to do this. No. If it says do not have to put on a bed pad on the bed, do not put another bed pad on there, because you don't have to. It's already there. So you're going to follow the instructions that are read to you in the scenario. You're going to follow what mock skills says, but you're going to do the scenario based on what the instructor reads to you. So she's going to read to you a scenario, and you want to make sure that when you go into that clinical setting that you are following all directions to get the proper credit. So if she tells you to just wash one side of the body, we're only washing one side of the body. If she says the right side, please make sure you refer to your right side. If she tells you the left side, please reply to the right side. Don't go and try to do the left side. Okay. Now, when it comes to the range of motion exercises, I'm going to be starting, that'll probably be one of my first. I'll probably do skills, and I'll probably start with range of motion because I see a lot of students, and I had one today. She came in and she did not perform all of the skills. She came in, she did partial of the skill. When they tell you to do your range of motion via hip and knee or shoulder and arm, you want to properly demonstrate all of that skill, which means you're going to do abduction, adduction, meaning that you're going to be holding the leg up under the knee and up under the ankle, and you're going to take it away from the body. It's abduction, just like you're getting abducted. So you're going to take it away from the body, abduction. When you're adding it to the body, it's adduction, adding it to the body, adduction. Now, when you're doing your extension, it's raising the leg straight up, extension. Then when you're bending, it's flexion. You're going to do 3 times. And you were taught in between those skills that you're supposed to ask, do that patient have any pain? Okay. Then you're going to do your hand sanitizing before and after that skill. I can't tell you how many people come in. They do just part of the skill. And I'm like, no, that's not what they asked. When you're doing that skill, what does it say in your mock skill sheet? So I always tell students, please, when you're coming in, if you come in early, try to ask your proctor, do you know what skills I'm going to have? And if she can, so that you got time to go over it in your mind. What are you doing in each of those skills? Okay. So when you're doing skills, you want to make sure you're following the instructions of the instructor, and also do what you were taught in class, but you want to make sure that you're following everything to the letter. Now, if you make a mistake, you can always say correction. You only have 30 minutes for the skills, so you may have to tell them, oh, I forgot correction. Let me go back and do my adduction. Or I forgot to say, are you in pain? I'm asking the patient, is she in pain? The reason that you're asking if the patient is in pain is because when you're doing that skill, if you push that person's arm or leg beyond that threshold, especially if they have any kind of contracture, because the reason that you're doing the exercises is because that person, he or she, may have had a contracture, and that's to straighten out that arm. So sometimes if you go beyond that person's threshold at that time, it may cause them pain. So if we cause pain, we're not going to do that exercise. So that is really the reason why they're training you to ask, are you in any pain? We're not just going to stretch that arm all the way out. You're going to go to the limit that person allows you, to the resistance. So when you're doing your exercises, yes, we're doing it on a mannequin, but really when you're getting to a clinical setting, especially as a rehab aide, you're only going to the threat to that person's resistance. So if that person resists at a point, that's why you're exercising, to try to get that resistance to go further and further out. But you can't just start just pulling that arm all the way out. So that's why we're asking if you're in pain. So the reason if you know why you're asking, because some people just think, oh, why are we doing all this? Because it's a method to the madness. You want to make sure that you're not hurting that patient. So that is one thing you want to take away with skills. So when you're doing your skills, you want to follow to the letter what is asked of you. Okay, know what skills that you're supposed to wash your hands. In the state of Michigan, you are to start with hand sanitizer and you end with hand washing. Hand washing is with every skill, and they want to know how long it takes to wash your hands. So you want to keep in mind when you're washing your hands, whatever method you were taught, were you taught ABC method, were you taught the 1, 2, 3, happy birthday, whatever method you were taught, you want to make sure that you're doing it 20 to 30 seconds of hand washing. Okay, so I will be demonstrating hand washing as well. That might be one of my skills that I'll do on the next video. I'll start with hand washing because that's one of the simpler ones, but you always start with hand sanitizer, and then what? Until your hands are completely dry. Hand sanitizer is not effective until your hands are completely dry. So you want to tell your proctor, my hands are completely dry, before you start your skills. Then that's when you start to collect all of your supplies. You do not supposed to touch anything, any supplies, until you do your hand sanitizer, because everything in the clinical, in the central supply room, which is pretty much set up in your classroom, is all considered clean. Until you clean your hands are dirty. So you want to make sure you do your hand sanitizer. So the first part of your skill is to start with hand sanitizing. So we may do that on the next video. And I wanted to stop here, and then we will come back on the next video with hand washing. Take care.